The views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Hello and good afternoon, everyone. I'm Aga Aison, and I'm your host for today's episode of Health Talk, your source on good talk, on good health, Health Talk. So I would like to greet first our live viewers this afternoon. Magandang hapon po sa inyong lahat. Thank you for joining us this afternoon in today's episode of Health Talk. And today we're going to talk about allergic rhinitis in the time of COVID-19. So I'm pretty sure every one of us is very much anxious of the symptoms we're feeling right now. Is it related to COVID-19? But those are the different questions that we have in mind today. And at the same time, we are also paranoid. Should we seek medications already coming from our health advisors or our doctors? So I think that this is the best time for our questions to be answered. So welcome to all of you, and I'm excited, of course, to welcome our guest speaker, doctor, this afternoon. So our doctor speaker for this afternoon is a fellow of International College of Surgeons, a fellow of Philippine College of Surgeons, a fellow of the Philippine Society of Otorhinolaryngology, Head and Neck Surgery. He also served as the residency training officer at the Department of Otorhinolaryngology in UST Hospital and currently serves as the chief of section of bronchoespagology at the UST Hospital. Our speaker also is the Assistant Medical Director in Justice Jose Abad Santos General Hospital. He is the chairman of the Department of Otorhinolaryngology in St. Martin de Porres Hospital. And lastly, the vice chairman of the Department of EENT at Delgado Hospital. So friends, without further ado, I welcome you, our guest speaker for this afternoon, Dr. John V. Silva. All right, so I think Doctor is having some technical problem right now. So of course, before we again call on our speaker this afternoon, gusto po namin pasalamatan kayong lahat for joining us. Of course, I would like to acknowledge our Zydus Healthcare Philippines team for, of course, for the full support coming from the different divisions of Zydus Healthcare Philippines, especially Zydus Respicare. So of course, full force ang Zydus Respicare in inviting all of their relatives, kapamilya, kapuso, kapatid, because of this purpose of course, spreading awareness and, of course, getting the right knowledge and information coming from our
Hello.
doctor speaker for today.
Hello.
Ayan.
Sorry.
Okay,
Sorry.
so
We encountered a small problem, no, with regards to my Unmuting myself. Okay,
Okay.
a pleasant afternoon to everyone, especially our viewers, our co-frontliners, and most especially to our patients. No, today I'd be talking about allergic rhinitis in a time of COVID-19. So this is a very apt topic for all of us, especially for a lot of us experiencing allergic rhinitis. No, so first, can I have the control, please? Oh, excuse me. Wait. Okay. Okay. So our objectives is to present current guidelines in the diagnosis and management of allergic rhinitis, especially in this time of COVID-19. So, what is allergic rhinitis? Allergic rhinitis is an IgE-mediated inflammatory process of the nasal mucosa elicited by common environmental allergens such as house dust mite, pollens, molds, or our animal danders, no? Which is characterized usually as inflammatory cells within the mucosa or submucosa. So the prevalence of allergic rhinitis worldwide is around 40%. And 40% of people with allergic rhinitis also have asthma. That's why this affects us a lot in terms of reduction of the quality of life, school, and work performance, and frequent visits to the clinics. So what are the common symptoms of allergic rhinitis? We usually have postnasal drip, sneezing, nasal itching, ocular symptoms, itchiness of the palate, rhinorrhea, nasal congestion, and commonly dry cough. So what are the classifications of allergic rhinitis? ARIA guidelines tells us that there's intermittent and persistent type of allergic rhinitis. Also, it can be mild or moderate to severe depending on the symptoms experienced by the patient. So with regards to management, the most common management for mild intermittent allergic rhinitis is oral antihistamine, the non-sedating type, and anti-leukotrienes. Some would use intranasal decongestants, but the best is still allergen avoidance. For moderate to severe intermittent, mild persistent, or moderate to severe persistent, we may add intranasal corticosteroids to our armamentarium. And if all of this fails, we may resort to immunotherapy. So what about COVID-19 or SARS-CoV-2, as we call it? No? It's a highly contagious virus that has worldwide community transmission and has a broad spectrum of disease from asymptomatic with mild symptoms to severe respiratory illness and sometimes fatal complications. What are the most common complications or symptoms of COVID-19? So, the primary symptoms are fever, severe cough, tiredness, accompanied by muscle aches or myalgia, difficulty of breathing, chills, sore throat, loss of taste or smell, headaches, chest pain, and sometimes diarrhea. But what is the diagnostic dilemma of us specialists in this time of COVID-19? Because a lot of symptoms are the same for both allergic rhinitis and COVID-19, such as cough, rhinorrhea or runny nose, anosmia, loss of smell, nasal obstruction, and ageusia, which is loss of taste. But one of the most um, common evidence nowadays is the loss of smell or anosmia, which is a big symptom seen in 30% of patients with COVID-19. So what do we do now, knowing that as ENTs, we deal with the nose, the throat, the larynx, the pharynx, which are more commonly where the viruses stay. So we are prone, or what shall we call it, exposed to the virus, like unlike all other specialties, no? So we have to determine which patients are elective, which cases are elective and urgent. So we use the technology nowadays, like telemedicine, wherein we could triage our patients and give our non-urgent appointments. There, we can answer their questions through telemedicine and some of our patients who need follow-up. This would limit exposure of both the patients and the healthcare workers, and there would be rapid evaluation of potential COVID-19 infected individuals. And this would encourage social distancing among us. We can also go for allergy testing so that we would know specifically what's the cause of our allergens. What allergens are causing our allergy, sorry, like house dust mite, pollens, animal danders, or molds. Now we go to the most important part of our diagnosis of allergic rhinitis, which is nasal endoscopy, which is an aerosol generating procedure. This means that viruses through cough or sneezing done by the patients in doing these procedures may endanger us, the healthcare workers, or even the other patients in our clinics. So, what do we do? Ideally, patients should be screened when doing this procedure for COVID 19. If patients are asymptomatic, then we can proceed with this procedure with utmost care. But if the patients are symptomatic or COVID-19 status is uncertain, it is best to delay this procedure and, if possible, wait until the patient's symptom resolve. Also, we should use our personal protective equipment such as masks, goggles, face shields, PPEs, gloves, and shoe covers. We should also use barriers and increase physical distance among us and our patients. No? We can also use diagnostic procedures such as CT scan as a substitute for nasal endoscopy if we're entertaining sinusitis or nasal polyposis. This would minimize the risk of endoscopic procedures and will not need can help our patients do telemedicine in their consult. No? So the most important thing right now in dealing with our patients with allergic rhinitis is avoidance measures that we told you a while ago. Medications can be given with thorough physical examination, history taking, and further testing if needed. But the most important thing is proper communication with our patients, wherein we can ask them what they're feeling and what they're experiencing. So that from there we could come up with certain treatment modalities for each and everyone. So with this, I would I would reiterate the importance of frequent hand washing, the use of alcohol-based hand sanitizers, the use of covering masks, especially when we cough, no? Cover your cough and sneeze so that you won't transmit the virus, knowing that this is airborne, no? Or droplet, no? Transmitted through droplets. And we should consider social distancing among ourselves. So with this, I thank you for listening, and we will entertain some questions from our host, Aga. Thank you.
All right. Thank you very much, Dr. John Silva, for that very informative lecture and discussion. So I'm pretty sure our audience have learned so much from your discussions today. But before we entertain questions, Doctor, from our live viewers, I would like to ask first a few questions with regards to your discussions today. So first question, Doctor. So as I said in the beginning, no, when this COVID-19 came in, especially dito sa Pilipinas, no, ang daming nagpanic, ang daming na paranoid kasi meron silang nasal itching, sneezing,
Yes.
teary eyes. So ito yung mga symptoms basically of allergic rhinitis. So how do we say that this is more than allergic rhinitis? That this could be COVID-19?
Well, Aga, no? As you all know, I usually get questions from my patients. Doc, paano na po ito? Usually, some of my patients, I already know that they have allergic rhinitis. Now, if their symptoms or even kung wala man, they usually ask me, Doc, may sipon po ako. Makati po ang ilong ko, makati po ang mata ko. Yun, medyo mag-iisip ako na baka allergic rhinitis. But if my patients have fever, body malaise, masakit ang katawan, parang trangkaso, like symptoms, I usually ask them for peace of mind to have them tested for COVID-19. Or probably loss of smell na walang cause, hindi naman nagbabara ang ilong pero nawala bigla ang pang-amoy. That's one telltale sign that they may have COVID-19. So it won't be bad naman if they would have it tested, no? For their own peace of mind also.
Yeah. All right, thank you for that clarification, Doctor.
Yes.
Ngayon naman, in your slide, you also said that 40% of the total world population has allergic rhinitis.
Yes,
No?
it's
So
very
ganun,
common. Yes.
yeah, like 4 in 10 people has allergic rhinitis.
Yes. Every
Mm-hmm.
4
In
out of
every 4
10 people.
and every 10, there's 4 of them who has allergic
Yes,
rhinitis.
yes.
Actually, isa ako dun, Doc.
Yes, yes.
Meron din po akong allergic rhinitis, no?
Yes, some
So,
patients, excuse me, Aga, no?
yeah,
Some
yeah.
patients may not experience it during childhood, but later on in life. And some naman, during childhood, meron sila, pero pagdating naman sa old age, nawawala. I've had patients like me. I don't have allergic rhinitis when I was young, but right now, minsan nagkakaroon ako allergic rhinitis attacks. Yeah.
Yeah, so when you say yung pag-occur ng allergic rhinitis, meaning to say there's no age.
There's no age limit. Yes, you can see it from both the young, the old, the middle age. Yes, everyone can experience allergic rhinitis. It encompasses all age groups. Yes.
Correct. So in this 40% of population, Doctor, 38% of them would have asthma. That's what
Yes.
presentation
Actually,
is.
we
So,
round it off to 40% also have asthma. And if I may add, 80% of asthmatics have allergic rhinitis.
allergic,
So para magkapatid yung dalawa. Yes.
exactly.
Allergic rhinitis, upper airway problem, asthma, lower airway problem. Yes.
Yan. So, which leads to my follow-up question, Doctor. So,
Yes.
paano naman, Doctor, ma-delineate if it's allergic rhinitis lang, wala kang asthma, or allergic rhinitis plus asthma ang sakit mo na?
Usually, allergic rhinitis is manifested by symptoms in our nose like sneezing, nasal congestion. Cough can be upper eh. While asthma, may wheezing, may difficulty of breathing. Kahit alam mong maluwag yung paghinga mo, pero sa baba, parang masikip ang paghinga mo. Or may wheezing talaga. That's why, if I find my patients with asthma, I also refer them to pulmo for evaluation. That's why kaibigan namin, yung mga kasamahan nating pulmo.
Yeah.
And they refer also their patients na may allergic rhinitis. Yes.
All right, Doc. So, I have my final question before we entertain questions from our Facebook Live viewers. Ang dami na pong...
marami na ba?
Yeah, Doc, marami na. We have actually 253 live viewers. So, it's actually a huge number already. So, thank you very much again for our live viewers for watching us.
Yes.
And of course, you have some doctor friends, also doctor na bumabati sa inyo. Kung nababasa niyo
Thank
po.
you
So
very
yung mga
much. Thank you. Hindi ko pa nababasa eh. Thank you very
bali,
much. Thank you very much.
yeah,
Magagaling yung mga doktor na kasama natin.
yeah, yes. Okay, doctor, now what medications naman, let's go to medications, do you usually give to symptomatic patients?
Well, first line of treatment for people with allergic rhinitis is local non-sedating antihistamine. But right now, there are combinations already of antihistamines and anti-leukotrienes, which is good, especially for patients who also have asthma, no? Because they work synergistically.
Mm,
Also, some would also give saline irrigation, no? Well,
yeah.
it's good, but you have in these times of COVID, you have to be careful in applying it to yourself. Make sure that there's no one else in the bathroom. It's only you. Kasi what if you're positive or not, diba? And it's good in the sense that it cleans and it regenerates also the nasal mucosa. Yes.
Mm, all right. So good you mentioned about sodium chloride, doctor. So let me just pick one question coming from our Facebook Live
Yes, yes, sure, sure,
viewer
sure,
regarding
sure.
sodium chloride spray.
Yes.
So sodium chloride spray okay during attacks of allergic rhinitis with nasal congestion at night? So that's question from Miss Joy Mauricio.
Some of my patients, or most of them, also get relieved in using sodium chloride, no? Especially the saline douche, no? In the sense that first, it cleans the nasal mucosa and it decreases the congestion.
Mhm.
Okay. So, and there's no side effects. Even the young, the old, or people with hypertension can use that safely. Safely. So there's no problem in using sodium chloride. But you have to distinguish that from intranasal corticosteroids. Because you might think it has the same effect. No, we give intranasal corticosteroids especially for moderate to severe cases. Okay?
All right, thank you for that clarification, doctor.
Yes.
Now, speaking of medication, there are also ano naman mga home remedies, 'di ba? Na usong-uso lalo pag allergic rhinitis 'yan.
Yes,
Sabi
like,
kasi ng mga matatanda, itong timplahin mo, ito gawin mo, etc. etc.
yes.
Yeah, so we have here one recipe, I could say,
Yes.
coming from our international audience, coming from, of course, India. Doctor, the question is, pwede ba is the combination of honey, black cumin, sesame oil, olive oil would be good in treating allergic rhinitis? Would this help after all, Doc?
I'll be honest with you, no. I don't have scientific evidence that backs this up, no. But if it relieves you of your congestion and everything, why not, no?
Mm.
Are they going to drink it? Iniinom po ba yun? Iniinom?
Yeah, yes, yes po.
Yes. Actually, ang lola ko ganun din. Honey and some salabat and everything.
Yes,
And it
yeah.
relieves her. But with regards to allergic rhinitis, the best treatment is still allergen avoidance. But with our environment right now, ang hirap po. That's why ang katuwang po natin dyan ay yung oral non-sedating antihistamine, which is safe. And ngayon po, may kombinasyon na. Yan po ang
Mhm.
mga ginagamit po natin. Yes.
Ayan. Thank you, Doctor, for that answer.
Apo.
Now, Doctor, mayroon naman ito isa. I don't know if you're familiar with this, if you've heard of this. Tuob. Are you familiar with tuob? Yeah, because
Actually, I've heard of that, no. Hindi ko pa nga alam yung specific. But sorry, I haven't heard of I haven't read about tuob, no.
mm,
Parang narinig ko lang. Alam ko may konting controversy diyan, but I can't say anything because I haven't read anything about what they're doing with tuob, no. Sorry.
mm,
Yes.
okay.
Parang ata yung steam inhalation, tama ba yan? If I'm not
Yeah,
mistaken, no.
mm, something
Parang
like
ganun
that.
ata
Yeah.
yun. Well, some would say it's soothing. Kasi yung heat, di ba? Pero I still have to find scientific evidence that will tell us that it is effective in treating allergic rhinitis. Why not? If it's good, no, why not? It's very simple and it's practical. Naman. But
Mm.
I don't know real scientific evidence pa that tells us that it's very effective. Yes.
Yeah, all right. Thank you, Doctor. Now, we're entertaining more questions, Doctor. I hope it's still okay with you.
Yeah, yeah.
So, question, Doctor, with regards to the taking of Montelukast, and you said also could be a combination. Could it be advisable from your end to take it on a long-term basis? Maintenance, ganyan, Doctor? Gaano katagal, gaano
Well,
kahaba ang medication?
yeah. Alam mo, my pedia, yung pedia ng kids ko, would give it for a month to 2 to 3 months. Eh. But me, I usually give it at 2 weeks first.
Mm.
Then we'll see if the symptoms abate, then well and good. But if symptoms are still there, but on a lesser note, I continue it until 1 month. Yes. Sometimes I combine it with oral, no, sorry, topical corticosteroid in treating moderate to severe allergic rhinitis.
Yan, all right. Now, Doctor, of course, meron tayong mga regular na ginagawang vaccination such as flu vaccine, Doctor.
Yes.
So, when you have this flu vaccine or flu shot, does it guarantee you na hindi ka magkakaroon ng allergic rhinitis or even COVID,
No.
mga ganyan?
Parati ako, thanks to my wife. Ang bait ng wife ko, parati kaming
Para,
flu vaccine yan
mm,
every year.
mm,
And, but unfortunately, minsan nagkakaroon pa rin kaming bouts of allergic rhinitis. You know, it
mm,
depends on the allergen, yung exposure mo sa allergen. Eh. Sometimes the allergen is too strong, so it will elicit an allergic response on the person. So you have to take antihistamines for that.
mm. So, Doctor, yung po bang allergic rhinitis daw ba ay nawawala? Or permanently ba pwedeng mawala ito? Pansamantala, babalik ulit?
Yes,
Ano?
minsan po nawawala, tapos babalik po. Once halimbawa, severe yung exposure natin sa allergen, nagtitrigger na naman po. Pero minsan nga, sabi ko nga po, I have patients na nung bata may allergic rhinitis. Nung tumanda, nawala. Meron rin naman po akong vice versa.
Mm.
But probably, ang naiisip ko lang po hindi sila nai-expose sa matindi pang allergen. Swerte. Or maganda yung environment nila. Maganda yung simoy ng hangin. Hindi po polluted. Ganun po.
Mm. Yeah. So good thing you mentioned about the environment, Doctor, no? Because
Mm.
especially if you live in the city, no? So talagang okay, challenging
Yes.
ang magkaroon ng clean and green environment sa paligid mo, 'di ba?
Ye-
Pollution is here and there.
Yes,
All
yes
of
po.
those allergens parang
Yes.
andyan na lahat nakapaligid sa iyo. So what advice could you give, Doctor, naman sa mga tao living in the city who's exposed to so much allergens?
Actually, na-notice ko rin po yan sa patients ko. Halimbawa, tiga dito, tapos biglang nagbakasyon. Sasabihin na, Dok, hindi ko na-experience yung allergies ko nung nandun ako sa probinsya. Well, probably nga, clean yung environment nila. Some would use face mask, but personally speaking, ako nga mas lalo akong nagbabahing pag nakamask ako Probably doon sa fiber. So it depends from person to person. Now, with regards to pollution, wala talaga tayong magagawa doon dito sa city. Talagang with a lot of vehicles, factories, ang dami talagang potential allergens. So talagang ingat, and pag halimbawa nakaramdam tayo, then we take our antihistamines so that it won't get worse. Yun.
Okay. Now naman, Doctor, ang dami kasing mga pet lovers naman. Alam mo naman ng mga Pinoy, di ba? Mahilig
Yes,
din sa
yes.
mga pets. Halos lahat ng household, they have their pets,
Yeah,
dogs,
yeah.
cats, etc. So, ano yung precautionary measure naman if you're a pet lover? I mean, you live with your pets inside your house
Yun,
or near your house?
I have a lot of patients who have the same dilemma. of having pets. They really love pets. But I always tell them, hindi ka matanggal-tanggal yung allergies nila. Probably ang pinakamaganda huwag naman sa loob ng bedroom nyo na. Para at least makarest kayo. Hindi kayo hikain or atakihin ng allergic rhinitis. Because some pets, especially the furry ones, talagang matinding animal dander nila. So talagang prevention But if you can't do it, talagang may iba talaga. They can't live without their pets. Parang mahal na mahal nila. So hindi naman natin mapipilit. If the symptoms get worse, then I give them proper medications and proper
Yeah.
advice. Yeah.
Correct. Now naman meron kasing kasabihan, take your vitamin C, diba, to keep allergies away. Totoo ba yun, doktor? Nakakatulong bang vitamin C?
Well, yeah. I myself, I'm taking vitamin C every day. It's not, it's good for your body, for your immune system and everything. So, wala namang masama doon.
But for allergic rhinitis?
Allergic rhinitis, ang experience ko, personal experience, kahit naman ako mag-vitamin C, I still experience, it depends on the allergen exposure talaga.
Okay. So, along with the vitamins or the supplements,
halimbawa, kahit naman ako naka-vitamin C, pumunta ako sa isang house na talagang amoy bagong pintura.
Yes.
Talagang my allergies flare.
Yeah, mati-trigger pa rin.
Yes,
doctor, no?
it gets triggered, yes.
Now, in this time of COVID, medyo masyado nang maingat yung mga tao, doktor, sa mga ginagamit nilang mga appliances, etc. Nauso na ang air purifier, air humidifier, lahat na lang ng mayroong air.
Yes.
So, doctor, does this help?
Well,
or which is
probably.
better?
Well, I really don't know which brand is good or what. I don't.
Purifier or humidifier, doctor?
Pero I think kinumbine na nila.
Mayroon din ganun.
Pero combined na lahat. Purifier talaga kung allergen ang gusto mong ma-address. Purifier talaga.
Purifier.
But some patients of mine, even before this happened, this COVID, naka-air purifier na. But talaga nag-flare up pa rin yung allergies nila. And the only way to contain these allergic reactions is through medications pa rin. And they get well, tapos after a few months, bumabalik din naman. Kung ma-expose na naman sila.
Yeah. Okay po. So, Doctor, we're now on our rainy season. So, nag-iba na yung natin, simoy ng hangin.
Yes.
So, now we're talking about cold air naman outside. So, how does this trigger allergic rhinitis and how could you help yourself?
Yes. Changes in temperature of our environment can trigger allergic rhinitis in our patients, especially from a shift from summer to rainy season or from cold season to summer. Ganon. Minsan nati-trigger. Well, if that happens and you get then we can take our oral antihistamines in order to just taper down the allergic process so that it won't affect our daily activities. Yan naman ang talagang malaking impact ng allergies.
Yeah.
Loss of daily activities. Loss of productivity ng isang person. Yes.
Correct. Actually, when you wake up in the morning tapos biglang sinumpong na yung mga allergic rhinitis mo, symptoms mo, lumabas na, parang, okay, I'll just go back to bed.
Precisely.
Sira na yung araw mo.
Nakakatamad eh. Yes. I can feel that for my patients. Yes.
Ayan. So, Doktor, kapag ma-generalize ba natin na kapag may allergic rhinitis ka, mahina na yung immune system mo?
Not necessarily. Hindi naman. Kasi it's innate yan allergic. I mean, napapasa pa yan from parents to children. So, it doesn't mean naman na mahina immune system nila. No? It's just that they're reactive to certain allergens in the environment. Iba-iba pa yan. Hindi naman porket lahat na magre-react ka doon. May iba nagre-react lang sa animal dander. Yung iba naman sa house dust mite. Minsan sa temperature lang. Iba. Person to person. So we have to take it individually. When I see my patients, I treat them individually. Hindi pare-pareho. Hindi So you have to thoroughly ask the history, Ano po ba nangyari before? Ano po ba naramdaman nila? Ano po ba ang ginagawa nyo before? Or natingnan na po ba kayo ng doktor? Ano po sinabi ng doktor?
Mm.
Pasensya na po pag makulit, pero makakabuti po yun para ma-evaluate mo na mabuti ang pasyente mo at mabigyan mo ng tamang lunas. Yung kung
Mm.
saan siya magiging hiyang.
Mm. Ayan. Yan, Doctor, you mentioned about the different levels pa yun or different classifications of allergic rhinitis, no? So when do you say na ano na to, malala na yung allergic rhinitis mo, severe, ganyan?
Well, ando ng sa area
Yeah.
classification, if it's bothering your sleep, your work, diba? Yung nasal congestion, severe na, that's it. It might be going towards moderate to severe. And sometimes, when you lose your smell or constantly your nose is congested or obstructed, you might entertain the fact that you might be experiencing nasal polyposis, which is another sequelae of allergic rhinitis. Or another way to another sequelae is rhinosinusitis,
Mm.
which is the infected stage of allergic rhinitis. Because of congestion, nagkakaroon ng stasis, nagkakaroon ng infection sa mga sinuses.
Mm.
So, ang mga manifestation nun, yun rin, yung mga nasal pain or pain in the maxillary area, mga ganun ba. Sometimes, yung mga severe may have fever also. So, in evaluating the patients, talagang kailangan thorough individualized.
Mm. Alright. So, Doctor, may mga pahabol pa po mga questions. Sana okay pa po sa inyo.
Sige,
Kasi
sige.
ganito ka na nakaparanoid yung mga tao when it comes to allergic rhinitis. Because honestly, doctor, no, I hope you may, I think you will also agree
Yes,
na when sinabing allergic rhinitis, most people would take it lightly. O wag na tayong magpakonsulta sa doktor. Ano na to, kaya na natin to sa sarili natin.
yes.
Ang dami naman diyang advertisement, may
Mm,
self-medication and all of that, di
mm.
ba? Ayun. So, good thing of course that we have this platform so that our viewers, our people could ask and learn from this
Aga,
discussion.
kasi alam mo, minsan nakakaawa rin yung iba nating pasyente kasi maganda rin yung ano ng mass media eh. Pero sometimes, nako-correlate nila ng mali. Halimbawa,
Mm,
sa ubo, Solmux. Pero hindi nila alam yung ubo pala allergic rhinitis ang
yeah.
cause. So, hindi sila gumagaling. Sabi, Dok, hindi ako ang dami ko na nainom, sorry for ano, yung mga cough suppressants or ano. Yung pala ang problem
Mm,
nila or ano, mucolytic kadalasan iniinom nila, wala naman talagang problema because the cause of their cough is allergic rhinitis. Di
mm,
ba? So, minsan, dinadirect lang natin sa tama. So, bibigyan natin ng antihistamine. Sometimes naman, kung yung ubo, productive, that's the time we give mucolytic. Yun.
yan. All right.
So,
So,
nandito tayo para tulungan yung mga pasyente natin. Malaman nila yung sakit nila una at pangalawa, malaman din nila kung ano yung tamang gamot dun sa sakit nila. Yan.
correct, correct. Now, doctor, speaking of medication, medication naman, gamot naman yung bibilhin ng isang pasyente or ng isang tao suffering from allergic rhinitis symptoms.
Opo.
Because there are OTC, di ba, doctor, na antihistamine. So, what could be better? I mean, there are cetirizine, loratadine versus levocetirizine, which is not OTC, doctor. So what's your stand on that?
Well, it depends from person to person. Some patients would react better with a certain antihistamine than the other antihistamines. Okay? Sometimes, nagbibigay pa nga ako ng mga sedating, yung luma, yung first gen. For
Mm,
people naman na sa sobrang allergy nila, hindi na sila makatulog. Gusto rin lang mapahinga naman sa gabi. So, you give them those. So, tailor-fitted lahat ng treatment natin sa nararanasan ng ating pasyente. So, yan ang importante doon eh. You have to tailor-fit all the treatment you're going to give for that certain patient. Hindi pwedeng parang factory. Bigay ka lang at
yeah,
alam ko yan.
yung one size fits all, ganun.
Ah,
So walang ganun. Ayan. Ito pa, Doktor, mayroon
Sometimes you
pang
might
tanong, yung
have to
paggamit
add.
daw. Yeah.
Yeah.
Yes po. Yes,
Kasi
go ahead, Doc.
sometimes you might have to add eh. May ina-add ka pa sa antihistamine para gumanda yung
Yes, yes.
to address yung simptomas ng pasyente yun.
Correct, correct. Ayan. Doktor, may nagtatanong dito no, kung okay lang po ba paggamit ng tissue everyday. Kasi di ba pag nag-sneeze, laging mayroon tayong dalang tissue or sa bahay when you go out
Wala
also.
namang problem.
Punas-punas tissue. It has
Walang
nothing to do.
masamang gumamit ng tissue. Wag nyo lang ipinapasok at yung parang inaano nila yung ilong kasi nagagasgas yung mucosa. So, sa pagkasgas ng mucosa, pwedeng dumugo. So, yung problema, minsan, siyempre, matataranta ko, ba't dumudugo ilong ko? Yung pala nagasgas mo na sa kaka, gano'n ng tissue. Kasi, you might think tissue yan eh. Pero minsan, sobrang nipis ng balat natin sa loob ng ating ilong. It's very thin skin, devoid of any subcutaneous fat. So, thin skin overlying a rich network of low-caliber vessels. Maliliit na mga ugat na konting masagi o magasgas, dudugo. So, yan yung kadalasang ano. Dok, biglang dumugo po eh. Malalaman mo, hindi ko naman kinakalikot. Biglang, pero makikita mo kasi yung tissue. Pinapasok ganon. Tapos pag tinilip mo yung ilong, puro sugat.
What about wipes ang ginamit, Dok?
Ha? Ano,
Paano
again?
pagka-wipes po yung ginamit?
Wala namang kaso, basta wag mo lang, pag singa, gentle ka dapat sa ilong mo. Wag mo na ipasok sa loob para linisin yan. It has its self-cleansing mechanism.
Ayan. Doctor, we have curious viewers here would like to know the connection of allergic rhinitis and acid reflux. Is it any way related?
Yes, there are newer studies that acid reflux may trigger allergic rhinitis. Why? Kasi yung tinatawag nilang laryngopharyngeal reflux disease, yung acid reflux, masyadong malakas na injection ng acid. Minsan umaabot sa nasal cavity. And you know, acid irritates the nasal mucosa, thereby eliciting a sort of an allergic rhinitis type of reaction. So, irritation eh. So, minsan, yung allergic rhinitis may be related. Yes, there are newer studies that have told us that allergic rhinitis may be elicited by acid reflux. That's why you also have to look into that. Yes.
Okay, that question, by the way, Doctor, is coming from Mr. Junar Occidental.
Ang
Pakilala
galing.
mo, Doc.
Ang galing ni Mr. Junar. Yes. Thank you very much, Mr. Junar. Yes.
Ayan. So, actually, we've asked a lot already. So, siguro, Doctor, probably na lang sa mga pambata naman.
Yes.
Kasi usually, in our discussions and questions a while ago, more of an adult concern.
Yes.
What about for kids? How do you treat kids? Is it different when you treat adults?
No, we also give oral antihistamines. But some oral antihistamines ang pwede lang sa certain age group. No? Meron pwede sa batang-bata, meron hanggang 12 years old lang and above, mga ganun. So you have to know that lang. Well, as a doctor, responsibilidad namin yun. Yes.
Ayan. So, Doctor, kung sakali daw na naka-oral antihistamine na sila, like, as you said, using the ARIA guidelines, no, antihistamine plus leukotriene receptor antagonist. So, is that well enough as a controller for their, allergic rhinitis symptoms?
Well,
or if they have asthma?
Sabing well enough. It depends on the patient. If they feel relieved of that, well and good. But if they still feel the symptoms, ang gagawin natin we would step up. We might add intranasal corticosteroids. Even for kids, pwede naman na. We just have to control the allergic process in order for it not to get worse. Yan ang habulin natin para sa mga anak natin, sa mga bata natin sa bahay. Especially those with allergic rhinitis.
Ayan. All right. So, Doctor, I will go to my last question po.
Yes.
No? And so, Doctor, when in your discussion, and of course, talking about our ENT, no? Ears, nose, throat, our respiratory tract, ganyan, ganyan. Everything. Ang tatlo ang lumalabas lagi ngayon, yung asthma, allergic rhinitis, and COVID-19. Because everyone's
Yes.
so
Related
so
eh. Sa symptom.
paranoid, 'di ba?
Yes.
Opo. So Doctor, finally po, as a closing question, again for our viewers, especially those na late na nakapanood, no? How do we how do you you know differentiate all of these three: asthma, allergic rhinitis, and COVID-19 po?
Okay.
Because you mentioned that you usually also treat and
Yes.
COVID patients po, no?
Yes. Well, first and foremost, walang tatalo sa magandang pagkuha ng history at pag-examine sa ating pasyente. Kaya importante talaga yan. Secondly, doon natin iisipin, matapos natin gawin yung magtatagalog na ako ha,
Yes.
para isipin natin kung yung mga ibang simptomas pa na pertinent sa COVID-19 like nga yung lagnat, pananakit ng katawan, at saka yung pagkawala ng pang-amoy, nandun rin. That will make us suspect kung maghinala tayo na baka ang pasyente natin hindi lang ordinaryong allergic rhinitis. Kaya importante, ang pinaka-importante ay komunikasyon at pangangalaga sa ating mga pasyente para malaman natin ang tamang diagnosis at matulungan natin sila kung maisuggest ba natin sa kanila na baka kailangan nilang magpa-testing for peace of mind. Kung lumabas na negative, we can proceed with treating them with our common allergic rhinitis treatment. If not, kung lumabas naman na COVID, then mas maganda maagapan natin. Pero mind you, Aga, marami
Yeah.
pa rin naman mga pasyente ngayon asymptomatic. Kaya yun rin iingatan natin, yung mga lalo na yung matatanda natin, ma-expose sa mga pasyenteng nagdadala ng COVID-19. Kasi tayo, yung mga medyo bata-bata, kamukha mo pala, na
Tayo,
you
Doctor,
can
tayo.
you can breathe through COVID eh. Yeah. Now I'm already 48 now and I have comorbids also. Pero yun na nga, yung mga bata, they can breathe through eh. Yun ang experience ngayon sa COVID. But yung mga elderly at saka yung may mga morbidities, yun ang matinding tinatamaan ng COVID-19. Yun ang iniingatan nating mga mahal natin sa buhay. Kaya that's why maganda na kung meron tayong nararamdaman, magpatingin tayo or kumonsulta man lang sa doktor.
And all right. So thank you very much once again to our guest doctor speaker for this afternoon on Health Talk, Dr. John V. Silva, for answering all of those questions. Napakarami, Doktor. Maraming
Thank you
maraming
very much.
salamat
Thank you
po.
very much, Aga.
Yeah. Any final word, Doktor, sa mga viewers natin? Marami pong bumabati sa inyo dyan, Doktor. Mayroon ko po isa-isahin, baka meron na kumakaligtaan eh.
Well,
But I could see that there are so many doctor viewers currently, Doktor, no? Sa 250 natin dyan, marami ring doctors na nanonood. So,
yeah.
thank you so much to all of them, our doctor
Yeah.
friends, especially
Actually,
yung mga fans mo, Doktor, and
actually,
friends.
ang the only message I could give our viewers is that mag-ingat po tayo parate. Let's stay safe. Let's be careful of our daily activities. At kung may nararamdaman po, kontakin natin ang ating mga doktor. Nandiyan po sila para sa inyo. Nakita naman po natin ang dedikasyon ng ating mga doktor sa atin. So, tayo po, on our part, let's be safe para sa ating pamilya. Especially during this time of COVID-19. Malalagpasan din po natin ito. Maraming salamat po.
And all right, so there you go, ladies and gentlemen, our speaker for this afternoon, Dr. John V. Silva, for a very enlightening discussion on the allergic rhinitis in the time of COVID-19. And of course, he mentioned about the doctors, our frontliners, of course, nurses, and the pharmacies, everybody working on the front line. We could, inside this Healthcare Philippines, continue to give its salutation to all of you. Mabuhay po kayo, and kudos to all your commitment and dedication in bringing back and or rebuilding the health of the Filipino people here and abroad. And so once again, we would like to thank everyone, especially our Facebook Live viewers, for joining us in today's discussion of Health Talk. Maraming salamat po to our Zydus team, especially Respiratory Care team, for inviting their friends and relatives, of course, para matuto din and maximize the use of social media, no, into this kind of advocacies. So this has been Aga Aison for Health Talk of Zach at Zydus. Thank you so much, everyone, and have a safe day.
Thank you.
Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.